day, I let her down. I let Charlene Murphy down. I let her family down. I let myself down.
What happened on December 26, 2017 was a tragic mistake. It was unintentional.
I saw my mother-in-law with all those people around her, working on her.
Charlene Murphey entered the radiology department at Vanderbilt University Medical Center, ready for a scan that would offer answers about her recent symptoms. Though she had faced countless medical challenges before, but this time her nerves were running high. She suffered from intense claustrophobia, a fear that had plagued her for years. As she approached the machine that would soon enclose her, her anxiety grew. To help ease her fear, the nurse caring for her was instructed to administer a sedative, one that would calm her and make the procedure more bearable. But as the nurse prepared the drug, a seemingly routine task, something began to go awry. The medication wasn't what it was supposed to be. Small but crucial steps were skipped, leading Charlene's care down a path no one expected. What exactly did the nurse overlook? How did a simple moment of distraction lead to the most tragic outcome? And who is ultimately responsible for what unfolded next? To get to the truth, we're about to unravel the events that led to this heartbreaking mistake and ask some important questions along the way. Now, before we continue, I'd like to ask you a small favor. Our channel is still new, and every single subscriber helps us grow. Your support motivates us to produce even more in-depth, high-quality content like this. So if you're enjoying these deep dives into medical mishaps and want to stay updated on future videos, please consider subscribing. It's a simple action that would mean the world to us and ensures you never miss out on any new cases. Now, without further ado, let's get back to the case. Charlene Murphey was born in the mid-1940s, during a time when traditional family values and community bonds were deeply emphasized in the United States. She grew up in Gallatin, Tennessee, a small and tight-knit town located northeast of Nashville. Gallatin is known for its strong sense of community, where neighbors often knew each other by name, and where life moved at a slower, more personal pace. It was within this nurturing environment that Charlene developed her core values: her love for family, loyalty to friends, and her deep connection to her church. Charlene was raised by hardworking parents who instilled in her a strong sense of responsibility and care for others. Her upbringing was modest but filled with love, and from an early age, she was known for her gentle, nurturing nature. As a child, she was described as inquisitive and warm-hearted, someone who was always looking out for her younger siblings or helping her parents with household chores. Murphy attended local schools in Gallatin, where she was well-liked by her peers and teachers alike. While there isn't much public documentation on her specific educational path, it is known that she was deeply integrated into her community from a young age. Church life played an important role in her upbringing. Like many Southern families of the time, Charlene's family attended services regularly, and faith became a cornerstone of her character. This sense of faith and community service would follow her throughout her life, shaping the way she interacted with others and handled the hardships that came her way. As Charlene grew into adulthood, she remained rooted in Gallatin. In her early 20s, she met and married her husband. While the details of her marriage are not widely publicized, it's clear that family life was extremely important to her. She became a devoted wife and mother, raising children in the same kind of nurturing environment that had shaped her own childhood. Charlene Murphey was known for her quiet strength and her role as the emotional anchor of her family. As her children grew older, she became a grandmother, a role she cherished deeply. Friends and family often spoke about her warmth and kindness, traits that defined her relationships with those around her. She was the type of person who would always have an open door, ready to welcome loved ones with a warm smile and a kind word. In addition to her family life, Charlene worked hard throughout her adult years. While the specific details of her career are not widely documented, it is known that she maintained a strong work ethic and balanced her responsibilities at home with her professional life. She was a woman who believed in contributing to her family and her community, and her efforts were deeply appreciated by all who knew her. As she entered her later years, Charlene began facing significant health challenges. Though largely private about her health, it became known to friends and family that Charlene had been diagnosed with cancer several years prior. This marked the beginning of a challenging journey, where her strength and resilience would be tested time and again. Murphy's initial diagnosis came in her early 70s. The specific type of cancer was never fully disclosed to the public, but surviving cancer in her age group is a testament to her enduring spirit. For many older adults, cancer is a particularly harrowing experience. The body's natural ability to fight diseases weakens with age, making treatment more grueling, especially when combined with pre-existing conditions that might have developed over the years. Cancer is, at its core, an abnormal growth of cells that can invade or spread to other parts of the body. For older patients like Charlene, chemotherapy, the most common treatment for cancer, is a double-edged sword. While it attacks cancer cells, it can also lead to significant side effects, such as severe fatigue, nausea, hair loss, and compromised immune systems. Charlene's treatment, based on her ability to live years post-diagnosis, likely included rounds of chemotherapy, radiation, or even surgery. It's common for patients with her profile to undergo surgical interventions to remove localized tumors, followed by chemotherapy or radiation to ensure the cancer is fully eliminated. This would have required multiple hospital stays, treatments, and adjustments to her lifestyle, but she powered through, emerging as a survivor. For the Murphy family, each year after her diagnosis felt like a blessing, a testament to Charlene's inner strength. While the cancer treatments prolonged her life, they were not without consequences. As is the case with many cancer survivors, Charlene faced long-term health challenges brought on by the treatments themselves. Chemotherapy, for instance, can lead to what is known as chemotherapy-induced cardiotoxicity, essentially heart damage caused by cancer treatment. This could result in heart failure, arrhythmias, irregular heartbeats, or other cardiovascular complications. Similarly, radiation, if it was part of her treatment plan, has long-term side effects, particularly if it is administered near critical organs. For instance, radiation in the chest area can lead to lung and heart problems years down the line, while radiation in other areas may cause nerve damage or scar tissue formation. These cumulative effects meant that even though Charlene was technically cancer-free, her body continued to bear the weight of her earlier battles. In the months leading up to her 2017 hospitalization, Charlene began experiencing a new set of symptoms, ones that were particularly concerning given her age and medical history. While the specifics of these early symptoms were not widely reported, brain bleeds, one of the conditions suspected during her final hospitalization, can often be preceded by headaches, dizziness, or confusion, symptoms that may have seemed minor at first but progressively worsened. A brain bleed, or intracranial hemorrhage, occurs when blood vessels in the brain rupture, causing blood to pool and press against brain tissue. This pressure can result in brain damage, a stroke, or even death if not treated promptly. Brain bleeds are particularly dangerous for older adults, whose blood vessels can become weakened over time, either due to age, high blood pressure, or previous health conditions like cancer. In Charlene's case, the onset of her symptoms likely triggered her visit to the hospital, where her condition was carefully evaluated by the medical team. Upon her admission to Vanderbilt University Medical Center in December 2017, Charlene was immediately evaluated for a potential brain bleed. Her family remained hopeful despite her complex medical history. By all accounts, her condition initially seemed to stabilize. medical professionals, including her doctors and nurses, were cautiously optimistic. She underwent various diagnostic procedures, including CT scans and MRIs, which are standard tests used to detect bleeding or abnormalities in the brain. A CT scan, an imaging technique that uses X-rays to create detailed pictures of the brain, was likely used to confirm whether a hemorrhage was present. In the days following her admission, Charlene's doctors prescribed treatments to manage her symptoms and closely monitored her vital signs. Her improving condition was a relief to her loved ones, many of whom had already endured the emotional roller coaster of her cancer battle. However, as is often the case with older patients facing complex medical issues, nothing was ever certain. Her doctors recommended a PET scan to get a more detailed understanding of her brain activity, and this procedure ultimately required a sedative to help ease her claustrophobia. As part of Charlene Murphy's treatment plan, her medical team recommended that she undergo a PET scan to further investigate her condition. Given her recent brain bleed symptoms and her medical history, the PET scan, a specialized imaging technique used to observe metabolic processes in the body, was crucial for the doctors to evaluate her brain activity in more detail. However, this particular test presented a challenge for Charlene due to her well-documented claustrophobia, a condition in which a person feels extreme discomfort or panic in enclosed spaces. Charlene's claustrophobia was something her family and doctors were well aware of, and it was not uncommon for patients undergoing PET or MRI scans to feel anxious or panicked in the confined space of the imaging machines. To make the process more comfortable and manageable for her, her doctor prescribed Versed, midazolam, a medication commonly used to reduce anxiety. Versed is a sedative that acts on the central nervous system to induce relaxation and drowsiness, making it easier for patients to undergo stressful procedures. For Charlene, the 1 mg dose prescribed was meant to soothe her nerves just enough to ensure she could handle the PET scan without overwhelming anxiety. On December 26, 2017, Redonda Vaught, a registered nurse assigned to assist with Charlene's care. Redonda Vaught, born and raised in rural Tennessee, came from a background that reflected the values of hard work, care for others, and a deep sense of responsibility. Little is publicly known about her early years, but like many healthcare professionals, her journey into nursing was driven by a desire to help others and make a difference in the lives of patients. Vaught completed her nursing education in Tennessee, receiving her certification as a registered nurse, RN. The RN qualification, which involves rigorous academic training followed by clinical practice, prepared her for a variety of roles in the healthcare field. Like many nurses, Vaught underwent countless hours of training in patient care, medication administration, emergency response, and more. During this period, she developed a skill set that would enable her to work in fast-paced environments, such as hospitals and clinics. Upon receiving her nursing license, Vaught initially took on various nursing roles, gaining experience in both general care and specialized medical areas. By the time she joined Vanderbilt University Medical Center, VUMC, in Nashville, she had established herself as a competent and dedicated healthcare professional. VUMC, one of the top hospitals in the Southeast, is known for its cutting-edge medical research and highly specialized care units, making it a desirable institution for nurses seeking challenging roles. Joining Vanderbilt University Medical Center, Redonda Vaught began working at VUMC in 2015, quickly becoming part of the hospital's extensive nursing staff. Her responsibilities at Vanderbilt varied, but she often worked as a help-all nurse, a demanding role that required her to assist other nursing teams across different units. This flexibility is common in large medical centers, where nurses are sometimes assigned to cover multiple departments as the need arises. The help-all role involved being called upon to support wherever the hospital required additional assistance. This could mean administering medications, assisting in surgeries, or providing care in high-pressure environments like the emergency room or intensive care units. These tasks required a great deal of multitasking and adaptability, as nurses in this role frequently moved from one high-stakes situation to another. During her tenure at VUMC, Vaught gained a reputation for her work ethic and professionalism. Her colleagues regarded her as reliable and competent, someone who could be trusted to carry out her duties effectively even in high-pressure environments. Her attention to detail and ability to handle stressful situations were qualities that allowed her to thrive in a complex, fast-paced hospital setting. But like many healthcare workers, Vaught faced the realities of burnout in her career. Nursing is an emotionally taxing profession with long shifts, physically demanding work, and the constant weight of responsibility for patients' well-being. Yet, Vaught continued to push through, managing her duties with dedication and persistence. This perseverance is perhaps what made the tragic events of December 2017 all the more shocking for her and those who knew her. During that time, Vaught had been working at Vanderbilt University Medical Center for over 2 years. She was tasked with administering the prescribed Versed. The process of retrieving medication at Vanderbilt involved the use of an automated medication dispensing system known as an AccuDose cabinet. These cabinets, designed to securely store medications and reduce human error, require healthcare professionals to input a patient's information and select the appropriate drug from the cabinet's interface. The system then releases the drug, ensuring that the right medication is given to the patient. However, at the time of the incident, Vanderbilt's system was reportedly experiencing integration issues between its electronic medical records, EMR, and the dispensing cabinet. This meant that, in some cases, medications were not listed in the cabinet as they should have been, forcing nurses like Vaught to perform an override to access certain medications. An override allows the user to bypass the system's safety checks and manually search for the medication they need, which was a relatively common practice among the hospital staff due to the ongoing technical issues. When Vaught searched for Versed in the AccuDose cabinet, she typed VE into the system. Unfortunately, the cabinet displayed vecuronium, a powerful paralytic used during surgeries instead of Versed. Vecuronium is a drug that causes full-body paralysis by blocking nerve signals to the muscles, making it impossible for the patient to breathe on their own without mechanical assistance. It is typically administered when patients are intubated and on a ventilator, as it ensures complete immobility during invasive procedures. Without realizing the severity of her error, Vaught selected vecuronium, withdrew the vial from the cabinet, and proceeded to reconstitute the medication for injection. The gravity of what happened next would only become apparent after it was too late. Vaught, under the impression that she had the correct drug, did not follow standard safety protocols that required her to double-check the medication label before administration. This lapse in judgment was later attributed to her becoming distracted while retrieving the medication. It was a critical oversight, as vecuronium is a life-threatening drug when given to a patient who is not prepared for full paralysis. Vaught drew the solution into the syringe and proceeded to Charlene Murphy's bedside in the radiology department. There, believing she was administering Versed, the sedative, Vaught injected the vecuronium directly into Murphy's system. As the vecuronium took effect, Charlene Murphy's body began to react in a way that was entirely consistent with what happens when a paralytic drug is administered without the necessary precautions. In Murphy's case, however, there was no anesthesiologist present, and she was conscious when the drug began to take effect. Vaught, unaware of the catastrophic mistake, left Charlene Murphy alone in the radiology department, believing she had administered the correct sedative, Versed. Within minutes, Murphy's muscles would have become completely paralyzed, including those required for breathing. Her body, unable to signal her diaphragm to expand and contract, began to shut down as oxygen levels plummeted. Respiratory arrest is one of the first life-threatening effects of vecuronium when not properly managed. When the radiology staff discovered Charlene unresponsive, it was already too late. Her breathing had stopped, and her body had slipped into a state of full paralysis. The staff immediately called for emergency medical assistance, and resuscitation efforts were initiated. However, the damage had been done. Without oxygen reaching her brain for a prolonged period, Murphy had suffered catastrophic brain damage. She was resuscitated temporarily, but her brain had been deprived of oxygen for too long. Murphy was declared brain dead soon after. It was during the chaotic moments following Charlene's collapse that Redonda Vaught realized something had gone terribly wrong. As she reviewed the medication administration in her mind, she began to understand the magnitude of her error. Vaught immediately informed her supervisors and the medical team that she had administered the wrong drug, a confession that marked the beginning of the investigation into the tragic mistake. Vaught's admission of guilt was swift. She acknowledged that she had been distracted when selecting the medication from the automatic dispensing system and had failed to verify the drug before administering it. In healthcare settings, it is standard procedure for nurses to follow the 5 rights of medication administration, a system designed to prevent such errors. These rights ensure that the right patient receives the right medication in the right dose via the right route at the right time. Unfortunately, in this case, Vaught had bypassed key safety checks due to the override of the automated system. Meanwhile, despite Vaught's immediate admission of guilt, VUMC did not report the medication error to federal or state authorities as required by law in cases involving serious adverse events. Instead, the hospital attributed Murphy's death to natural causes in their report to the county medical examiner, omitting any mention of the medication error. This failure to disclose the full circumstances of Murphy's death raised serious ethical and legal questions about VUMC's handling of the situation. The hospital did reach an out-of-court settlement with Charlene Murphy's family in early 2018, which effectively prevented them from publicly discussing the details surrounding her death. It wasn't until October 2018 when an anonymous whistleblower reported the incident to the Centers for Medicare and Medicaid Services, CMS, that a formal investigation was launched. CMS conducted a thorough inspection and subsequently issued a statement of deficiencies to Vanderbilt, citing the hospital for its failure to report the medication error. This prompted further scrutiny of the hospital's medication administration processes, particularly the use of system overrides in the automated dispensing cabinets. In 2019, the Tennessee Bureau of Investigation, TBI, launched a criminal investigation into Charlene Murphy's death. The investigation resulted in Redonda Vaught being charged with reckless homicide and abuse of an impaired adult, serious charges that could lead to significant prison time. Reckless homicide, a Class D felony in Tennessee, is defined as a criminal act that results in the death of another due to reckless behavior. The abuse charge stemmed from Vaught's failure to follow standard medical protocols, which the prosecution argued contributed to the fatal outcome. On February 4, 2019, Vaught was arrested and formally charged. The case gained national attention as it was rare for a nurse to face criminal prosecution for a medical error. Many within the healthcare community feared the case could set a dangerous precedent for criminalizing mistakes in the medical field, which are typically handled through civil lawsuits or by state licensing boards. Vaught's defense team argued that she had made an honest mistake, one exacerbated by system-wide issues at Vanderbilt, including the frequent need to override the automated medication dispensing system. Her attorney contended that Vaught had been a scapegoat for larger systemic problems, and that the hospital had contributed to the environment in which such an error could occur. The criminal trial began in March 2022, more than 4 years after Charlene Murphy's death. During the proceedings, the prosecution presented evidence showing that Vaught had bypassed multiple safety protocols, including failing to double-check the medication label, despite several opportunities to do so. They argued that Vaught's actions constituted gross neglect and that her behavior fell far below the standard of care expected from a trained nurse.
Redonda Vaught recklessly ignored everything that she learned in school and everything that this pen represents.
Vanderbilt's medication safety officer testified that while the hospital had experienced technical problems with its medication cabinets earlier in 2017, those issues had reportedly been resolved by the time of Murphy's death. The hospital maintained that the override was not necessary in this case, and Vaught's failure to exercise caution directly led to the tragedy. The defense, meanwhile, focused on the broader context of the healthcare system. They pointed out that overrides were a common practice at Vanderbilt and other hospitals due to integration issues between the EMR and the medication cabinets. Additionally, they called attention to the pressures faced by healthcare workers, including long shifts and the stress of juggling multiple patient needs. In a dramatic moment during the trial, the jury heard an audio recording of Vaught's interview with law enforcement, where she admitted to the drug error, saying, "I probably just killed a patient." This statement, along with Vaught's open admission of guilt, was a pivotal moment in the trial, leaving a profound impact on the courtroom.
That day, I let her down. I let Charlene Murphey down. I let her family down. I let myself down.
On March 25, 2022, after a 3-day trial, the jury found Redonda Vaught guilty of criminally negligent homicide and gross neglect of an impaired adult. However, she was acquitted of the more serious charge of reckless homicide. The jury concluded that while Vaught's actions were negligent, they did not meet the threshold for reckless disregard for human life. Vaught faced a potential sentence of 3 to 6 years in prison for the charges of gross neglect and 1 to 2 years for negligent homicide. However, during her sentencing hearing in May 2022, the presiding judge chose to grant her leniency, given her lack of prior criminal history in the context of the error. Vaught was sentenced to 3 years of supervised probation, sparing her from serving time in prison. The case ignited widespread debate within the healthcare community. Nursing organizations, such as the American Nurses Association, ANA, and the Tennessee Nurses Association, TNA, expressed concerns that the criminalization of medical errors could create a chilling effect. They warned that fear of prosecution might discourage nurses from reporting errors or near misses, potentially compromising patient safety and transparency in healthcare. On the other hand, prosecutors maintained that the verdict was not an indictment of the nursing profession as a whole, but rather a necessary response to gross neglect that had led to a patient's death. They argued that holding Vaught accountable was critical to ensuring patient safety and upholding the standards of care expected in medical institutions. While much of the public focus was on the legal proceedings surrounding Redonda Vaught, it is important to remember that Charlene left behind grieving loved ones, including her children, who were directly impacted by the tragic mistake.
I saw my mother-in-law with all those people around her, working on her.
Her son and daughter have largely remained out of the media spotlight, but their presence during the legal proceedings was felt. Despite the outpouring of sympathy for Redonda Vaught from the nursing community, it's critical to recognize that the Murphy family endured an unimaginable loss. Photos surfaced of her children, highlighting the emotional weight of losing a mother and grandmother due to what was described as a preventable mistake. In the court hearings, Vaught's defense team made sure to emphasize her remorse and the fact that she had immediately confessed to her mistake. Despite this, the pain felt by Charlene's family was undeniable. While they remained relatively quiet during the public discourse, their grief and heartbreak were acknowledged by both legal teams and medical professionals. The Murphy family's quiet dignity during the proceedings was a testament to their character. It was also noted that the family had reached an out-of-court settlement with Vanderbilt University Medical Center, which likely involved confidentiality agreements that limited what they could publicly say about their mother's death. Nevertheless, the impact of losing a loved one under such circumstances reverberated throughout their community. The trial and conviction of Redonda Vaught sparked an unprecedented response from the nursing community across the country. Thousands of nurses and healthcare professionals rallied in support of Vaught, arguing that her conviction set a dangerous precedent that could criminalize medical errors, which are often the result of systemic issues rather than individual negligence. The protests that erupted outside the Nashville courthouse in the days leading up to Redonda Vaught's sentencing reflected a deeply divided response to the case. On one hand, healthcare professionals argued that criminalizing honest mistakes would create a culture of fear in hospitals, discouraging transparency and openness when errors occur. Many of them holding signs like, "We are all Redonda and nurses are human too," voiced their concern that such a precedent would undermine patient safety in the long run. On the other hand, the prosecution maintained that accountability was necessary, especially in cases where gross neglect led to the death of a patient. That brings us to some critical questions. Do you think the sentencing was fair? Should nurses and healthcare professionals be held criminally responsible for mistakes made under pressure? Or does this unfairly target individuals in an already overburdened system? What are your thoughts on the protests that supported Redonda Vaught? And do you believe they highlight a larger issue within the healthcare industry? Lastly, how do we balance the need for accountability with the need for a just and supportive environment for healthcare workers and patients alike? We'd love to hear your thoughts, so please comment below and let us know what you think about this case. Don't forget to like this video, subscribe to the channel, and hit the bell icon to get notified of our latest uploads. And if you haven't watched our previous videos, 2 of them will be appearing on your screen now. Check them out to dive into more intriguing cases. Thank you for watching.